Good morning and welcome to Glaucoma on radio on Solid 100.9 FM. Right, good morning. Welcome to Glaucoma on radio on Solid 100.9 FM Enugu. Proudly brought to you in collaboration with the Eye Specialist Hospital Enugu, Nigeria. Today, we are focusing on a condition often called the silent thief of sight, and that is glaucoma. My name is Chibika James, and this is Viewpoint the Conversation, Glaucoma Special on Solid 100.9 FM. It is said that many people lose their vision not because it cannot be prevented, but because of little mistakes and neglect that carries big consequences. Our topic today is glaucoma, small mistakes, big consequences. And we have with us Dr. Obinna Shiwobi. He is an expert ophthalmologist who will help us understand how to protect our eyes and preserve our vision. Doc, good morning and good to have you, sir.
The Bayandalun, Nabolachi. Good morning.
All right, good morning and good to have you. Doc, for someone who is about hearing this glaucoma for the very first time, what exactly it is? Because it's best we, get to lay down the foundation.
Yeah, okay. Thank you so much, my brother Chibike. Just to say that we want to thank the Solid FM 100.9 for this privilege given to us to spread this information. We want to appreciate the management and the staff for this cooperative to our people, cooperative support to our people. I think it is something beneficial to all and sundry.
Yeah.
And we want to say glaucoma is the commonest cause of irreversible blindness in Nigeria. And for now, we are here to find a cure for glaucoma. And very importantly, the symptoms come late. So for somebody priding himself that I have no issues with my eyes, might actually be having glaucoma not knowing it. And why we call it the thief of eyesight, that like my brother Chibike said, is because the symptoms don't come early. By the time it becomes symptomatic, it's already in an advanced stage, except for those who have regular checkups, who have annual checkups on their eyes. And like we know, it's commonest among the blacks worldwide. In some literature they say the Asians and the blacks. But we know that it's commonest among the blacks. And then, we keep saying that in the Nigerian in Africa, it's commonest in West Africa. And in the Nigerian study, the survey of Nigeria study, prevalence of visual impairment and blindness study in Nigeria, it was commonest among the Igbos. So we talk to our people that this is not a myth. This is something that is real and that this is fact. That's, we want to spread information that everybody should have his eyes checked annually.
You talked about stage, okay?
Yes.
Talking about us in the southeast or in Nigeria, at what stage do most patients usually realize that they have glaucoma?
Okay, thank you so much. It could be mild, it could be moderate, it could be severe. And in that, because the last vision to be affected is the central vision. It comes from the periphery, it comes from the sides. And the vision starts narrowing from the sides. And because the patient retains that central vision, which is what we use most times. Patient feels, I have no issues. Until by the time it starts affecting the central vision, that's when the patient begins to say, sorry, there's a problem. And then closes one eye and finds out that the other eye is not even seeing well.
Yeah.
And then it comes to the hospital,
Yeah.
And we'll tell him, okay, sorry, it's not something that you do glasses or you use glasses for to improve your vision. See, you have a glaucoma. And that's what is done internationally, is to protect what the patient came with, because it is an irreversible disease. because it's irreversible, you don't tell patients, you don't give patient false hope that I will improve your vision, except there are comorbidities, like patient has cataracts or also has refractive error. Then when you have stabilized the eye, you can now refract the patient, But we know if it is purely glaucoma, that it is not reversible. Your work at that time as an eye expert is to protect the vision the patient came with. You don't give patient false hope that you're going to improve the vision.
Improve the vision, yeah.
So that is why we say it's a thief of eyesight. Thief in the sense that, you can imagine, typically you keep 20,000 naira in a drawer, and somebody comes here to remove, maybe the 20,000 naira is in 100 naira notes, and the person sleeps every morning, he will just take one note off.
You won't know.
You won't know. You know, by the time you know, you said something this morning seemed not to be
surplus.
more than half had gone, because it is a gradual reduction.
Yeah.
So your eye tends to adjust to the reduction gradually. Do you understand? As he does it, unlike he comes and he removes half of it. I mean, when he comes and he says, something is wrong somewhere, and you now look at it. So that's why it's a thief of eyesight. So it steals vision gradually, asymptomatically.
Interesting. Doc, just for people who are just tuning in, well, you haven't missed so much. It is the Glaucoma special on Solid 100.9 FM. And this one is brought to you in collaboration with the Eye Specialist Hospital Tesh, Enugu, Nigeria. And today we'll be talking about glaucoma, small mistakes, big consequences. And with me in the studio is Dr. Obinna Ashiwobi. And yes, we have been able to, lay down the foundation of what glaucoma is all about and why it's often referred to as the silent thief of a sight. And yes, Doc has also gone as far as telling us the stage when patients usually get to understand and realize that they have glaucoma. Let's take our discussion further, Doc, to the causes and the risk factors. Okay,
beautiful.
Because you have talked about the fact that in the southeast it is more often in the south and even in Nigeria or even in Africa. What are the common risk factors that make someone more prone to developing this glaucoma? Is it something that is it sexually transmitted, or how will someone get all of this?
Yes, not by, it doesn't go by air.
Yeah, if you fly by village people, all those kind of things.
People, yes. So such things. Okay, thank you, James. The first thing you touched on was causes. What causes it?
Yeah.
Now, primary glaucoma, which is about the 90% of glaucomas we have. Primary means in medical time, it means there is no known cause. We say essential hypertension, primary hypertension. You can't say, look at what caused it. It just came.
Okay. Yeah.
In primary glaucoma, which is about 90% of glaucomas, there is you can't lay a hand on anything. So you can't say, look at what caused it. Now, in secondary, and then those primary glaucomas are not preventable. You can't prevent them. You can't prevent them from happening. If it will come, it will come. Now, secondary glaucomas they have a cause. Okay. Abuse of eye drops that you shouldn't be using, especially steroids. Trauma, somebody hits the eye. Use of what we call traditional eye medications. Other disease conditions. That can narrow the angle or increase production. So all these are secondary causes. So those secondary causes can be treated, and because they can be prevented. If you don't abuse steroids, you're not bound to have steroid-induced glaucoma. If you are careful and you are not, you are the type that doesn't like fights. So you won't, or you are the person in an industry, you are cautious with use of chemicals and everything.
Yeah.
So you will have trauma to the eyes, and then you're the type who doesn't like trouble, and somebody who's looking for trouble, you kind of walk away, because the next thing, the person blows into your eyes, and then you have a hemorrhage in the eyes, which blocks drainage of the aqueous, and the pressures will build up, and these pressures can be very annoying. So These are reasons. Then for those who have diabetes uncontrolled, may have what we call neovascular glaucoma. These are very terrible glaucomas, So we can, these ones are preventable. We can prevent the causes and then stop the problem. But the primary glaucoma is the one we talk about risk factors and the established risk, like you said. We are blacks. And they found out in the Igbos there's a particular gene that is, that is inherent in us. Now, why have I said this? It is almost every tribe in the world have a peculiar disease by virtue of genetic predispositions. Now, it is not behavioral. You understand? It is not environmental. It's not because we live in the southeast. If we move in the Igbo to south, they will still be having the glaucoma. The prevalence will still be the same, So it is not geographical like trachoma because of the dry, dusty, windy environment of the north, So that one is geographical, is environmental because of the weather conditions. So it drives trachoma, not glaucoma. So we know it can be genetic. 2, we know it runs in families. That is very important to know. Then thirdly, we know those who have myopia. Short-sightedness are prone to glaucomas. Those who also have long-sightedness are also prone to what we call angle closure glaucomas, while the myopic patients are more prone to the primary open angle glaucomas. So hypertension is a very big risk factor, very important. Diabetes, is a very important risk factor. Migraine, cardiovascular issues, and then we said race as per we are blacks now, and then we've talked about the other. So these are the risk factors that can predispose one. These are things we know, that has been established over the years. And then for those who have increased intraocular pressures, for whatever reason, are also prone, for you to become, because not all raised intraocular pressures are glaucomas. It could just be ocular hypertension, and then that can be treated. So, all I'm trying to say that these are the known risk factors to glaucoma, and our people should know this, and then do their best.
Okay.
To have annual checkups. Coming to this, the small mistakes. This is okay. Maybe let me
let's get it. But there's really something I really want to also talk about on this risk factors and causes. Glaucoma runs in families, correct?
Yes, correct.
Okay. Are there like lifestyle habits that increases one's chances of developing this disease?
Yes. Those risk factors are, we mentioned earlier, those who take caffeine.
Oh.
Yes. Those who do exercises that the body is always above the head.
Okay.
Yes. These are about those who abuse steroids, by mouth or by putting it into their eyes. Now those who also put other what we call traditional eye medications. Now, those who are violent in nature, do you understand? Because they tend to have, fights, and then, what else? Very importantly, those who do not have annual checkups, because they wouldn't know when it will come. For those who feel that, I'm okay, I don't need to have my eyes checked. My grandfather saw T100, my father saw T100. Who told you that your great-grandfather was not blind from glaucoma? So some diseases jump generations. Do you understand?
Yeah.
That's why when people boast, you have a child, you are dark in complexion, your wife is dark in complexion, and you're having a fair child, and you're making noise about it. And then somebody comes to tell you that, your grandfather must have been very fair, So I want to say that some diseases can jump generation. Not that the fact that your father does not have it does not mean it will not come. And then very importantly, it can come at any time. To anybody, whether there's a family history or no family history. So everybody is prone to having glaucoma.
Everybody is prone
Yes.
to having it. Now, let's now go straight to the main discourse of this morning, which is small mistake, big consequences. Okay, what are those? What are some of those small mistakes that people make in relation to eye care that could lead to big consequences with glaucoma, doc?
Thank you so much. Okay, so that is the crux of the matter. We are there, and that is very important. And the fact, the biggest deceit is, it is not my portion. That is the biggest deceit. It is not my portion. And we don't know the person that will have glaucoma. Nobody can tell you this person will have glaucoma. There are people whose parents have glaucoma, both mother and father, and they're going to come down with glaucoma. And that's someone whose parents never had glaucoma, whose grandparents never had glaucoma, and it's coming down with glaucoma. So, as I said, everybody can have glaucoma. Anybody. So that deceit that is not my portion, that you are now looking at your parents. There's nobody who says because your father lived to 100, you get to live to 100. Do you understand? That's what I'm trying to say. And your father lived to 100, your mother lived to 100. So somebody says, oh, you have longevity on your side. I mean, you never can tell, what can take you. So that is the very first deceit, that I will not have it. It is not my portion. So people should learn to be factual in life. And then very importantly is that you don't tell yourself, for those who are already diagnosed as having glaucoma, drugs are used for life. And so you don't come to the doctor and he gives you medications for a month, for 2 months, and says, I'll see you in 3 months' time. And then after a month you stop. And you are telling people that, oh, that was when the doctor gave me to come in 3 months' time. But the doctor had told you, many times our patients tend to listen to what they want to hear. All that you have said, they want to keep the one they want, the favor, not all that you've said. So, it's one big mistake our people make, Then, very importantly too, people tend to say there is no cure, which is true. But very importantly, in that regard, is the fact they said they don't know that other modes of management exist. Yes, like first thing we give, which is cheaper, which is available, which is affordable, eye drops.
Okay.
Yeah, so it is affordable, it is available, and it's easier for patients to apply. And then, but they are told these drugs are meant to bring your pressure down. Now, if you don't we don't know whether it has come down. There are drugs that will still fail despite being given. And then we may start with, depending on the pressure the patient came with, and also the visual impairment the patient came with. We may decide to give one eye drop, or do a combination, that is 2 eye drops combined as 1 eye drop. All I'm trying to say, so you can give one or give multiple eye drops. Now, it's only when you come back that the doctor knows that, oh, this pressure is now controlled, and now you say, patient, okay, continue with this, maintain this. And then our people say, doctor, now you the same drug. No, the doctor is checking many factors when he comes. He's checking your vision, what you're able to read, to know whether he's protecting their vision. He's checking your pressure. Is it under good control? Control to the sense of what we call target pressure, that these pressures cannot cause harm. He's also checking your field of vision. So he's checking a lot of things. And then he says, continue your medication. You are doing well.
Yeah.
And the patient goes. Now, if you come and your vision has dropped from what you read before, you're unable to read it again, he feels that, oh, there's a problem somewhere. He checks your pressure, it is high. He will increase your pressure. Now, this is the way you manage. Then he will be doing your field of a visual field to know if your visual field is intact or it is contracting. Now, there are a lot of parameters we use. But that is only when the patient presents himself for checkup.
And talking about this checkup, what if someone skips regular eye checkup? What
No,
danger do that
yeah.
person find himself in?
So that's also one of the small mistakes. You know. Now this patient will not know that the usual drug that she used in 2023 and her pressures were beautifully under good control.
Yeah.
Now she used the same drug in 2024.
Uh-huh.
Mid 2024. You give him 3 months to come back, and he feels like, why do I even go to there? Let
It's
me
still
just
going
go.
to be the same.
Let me go and go to the club, and let me go somewhere else. Let me go and do this. Why will I? Is it for the doctor to take money again? Is it not the same drug that he will give me? And then at that point, he does not know that his pressures have started rising. Now, if you are seeing the doctor, he may add additional drug for you, or he may discuss with you other modes of treatment. And now, so it becomes dangerous, and that's why the consequences. I saw a patient yesterday. As at the time he came 2 years ago, he was doing quite well with both eyes. As at yesterday, you can see he's now visually impaired on both eyes.
Wow.
And I told him, young man, what is the problem? Yes, you may say cost of medications, the eye drops. I told him blindness is costlier. I don't know what you do if you are an Okada rider and you can no longer do the Okada riding. How do you now make money? Do you understand?
Yeah,
We make
true.
money to be alive, to sustain ourselves, to keep ourselves alive and in good health. So if you don't do the needful, you are in trouble. So, and I told him, see, you are now visually impaired. Now, I'm going to control this pressure, but I will not, restoring back lost vision.
It's not something you can
Not
do.
something I can do.
Yeah.
You can see that the cup, this ratio, there's more damage has happened. And these damage are irreversible. I can't reverse them. I'm just being frank with you. If you do more, I'm surprised. You look at your age. You're barely less than 40. Do you want to go blind at this age? Who will provide for you? So you are doing your business. You're an Okada rider. He's also doing it to protect yourself, to keep working. So it's also one of the small mistakes. People think I can't do it. I don't need to go to hospital. So it comes to what we said about checkups. It is when the doctor sees you, it's good for the doctor to see you and say, oh, you're okay. It's like somebody who comes for annual checkups. I would say you're doing well, go. And then they say, nah, why will I go and stand on the line again and waste my time? And they will tell me I'm doing well, go, come back next year. And by the time the disease creeps in, you wouldn't know because, so let me also give example with what we call hypertension.
All right.
The blood pressures people measure. You go today, it is normal. You come in 3 months' time, you measure, or come monthly is normal, and they say my BP is usually normal. And then one day you are doing something and you slump, and people measure your pressure and they say it was 200 over 120, and people are like, but the American's pressure is usually normal.
What
Do you understand what happened? Prior to last year, my beers were not white, but now they're now white. So do you understand? I can't go and call police that they're white. So what does that mean? It means that as we grow older, the body changes. Nobody knows what aging will bring. So that is very important fact about it. And then it's good for people to know. I've had people say there is no glaucoma. Are they a surgery? Are they a operation? And that is lies. 100% false. And now that person, who told you this? He said he went to hospital. That person does not know anything about glaucoma. My mother has had glaucoma surgery 25 years ago. If not for those surgeries, she wouldn't be seen by now. She's 81. She wouldn't be seen by now. So when people say these things, and you see patients who undergo surgeries and their pressures are under control. When do we do surgeries? For those who maintain their checkups, we tell them these drugs are no longer able to control your pressures. Despite maximum medications, your pressures are still high. And then the question will be, what other thing? So we may try lasers, we may do surgeries. You know.
Yeah.
So these are very important. So our people should realize that you don't. I'm a medical doctor. I have a physician who looks after me too. Do you understand? Because that is what is appropriate. You know, I can't be in my house and pontificate on my health status. You know, I also have to go out and see other doctors who will look at me as a patient and advise me appropriately. So I think our people should realize this. Now, we talked about this issue of annual checkups, you know, and somebody is boasting, year in, year out, I don't go to hospital. Oh. And one day you hear the person slumped. And that, like I said, the pressure is measured, the pressure is 200, 120. How would you have known that your pressures were high if you hadn't come to hospital? You know, how would you know you had diabetes if you hadn't checked your blood sugar? You know, how would you know that your cholesterol is high if you don't check it?
So how often should people now go for these eye checkups?
Okay, thank you so much, Chibike. Annually. Does it take
Once
much?
in a year?
Once in a year. Almost like taking a bottle of beer. You know? So just annually, once in a year. You know? Then we advise people a year after your birthday. You know? So that, you know, why we don't say before your birthday, so that if you see anything that is not,
go spoil
not
the plans.
pleasant,
Yeah.
you know, it won't spoil your birthday. So you can do it a day after your birthday. I mean, a week after your birthday.
There's this question that people are always asking, and I just want you to clarify. Is glaucoma preventable,
Beautiful.
or is it only manageable after diagnosis?
Okay, so glaucoma, primary glaucomas are not preventable.
Okay.
Secondary glaucomas are preventable. But complications of glaucomas are preventable. Yes. So that is the beauty of it. You know, that's why I said by checkup that you have is keep telling you be cautious. Do you understand?
Yeah.
That you go and check okay, your sugars are high, and then somebody tells you, okay, you have to moderate, you have to really adjust your lifestyle. You have to adjust a lot of things. You know, you don't see Coke or malt and you grab it. Do you understand? You know, so same thing with glaucoma. You also need to change yourself. You also need to tell yourself the truth. Then now people, Google it, read about it. So when you come to see an ophthalmologist, you ask questions, you throw questions to him, and he knows that you're also reading, you know, and then you are informed. So glaucomas, the primary glaucomas are not preventable. Secondary glaucomas are preventable. But more importantly, the complications, the visual impairment, the blindness from glaucomas are very, very preventable.
Very, very preventable. And let's get to hear from you and get your questions and reactions as well. The numbers to call are 0704 550 2840, 0909 771 1009. And yes, you can also call 0902 311 1009. Okay, these are the numbers for you to call to be part of the program. And please, once you get through to us, try to make your question and contribution as precise as possible. Once again, 0704 550 2840, 0909 771 1009. And you can also call 0902 311 1009. Hello, good morning to you. Hello. Alright, you call me back 0704 550 2840. Let's take more calls. Hello, good morning.
Good morning, sir.
Yes, good morning to you.
My name is Mr. Matthew. I'm calling from Akpa, Kogi State.
Mr. Matthew, all the way from Kogi State. Good to have you, Mr. Matthew.
Oh, thank you very much. I am very happy for this awareness you are creating for this discussion. God bless you.
Thank you.
The problem I want to put before the doctor in the studio is that, you see, I had I was diagnosed of glaucoma and cataract more than 20 years now. So what happened was that really I put acid battery acid in my eye. That was early 90s. So this thing came up that to disturb me in 2009. So then I went to the hospital. As they going to hospital, they recommended some medicine for me. And I've been taking those medicines from one medicine to another. As I've been going, they've been changing the drug that I've been applying. So in this case, but I'm no more in the town where I used to go to the hospital, but I'm in the Ampa now, where the eye medical is not very common. So, and the problem now is that the most problem and the medicine they recommended for me that I'm using, when I'm taking it now, so my eye, I do have I'm an asthmatic patient. So anytime I put that medicine, a drug for my eye, it rises up the asthma. Then I'll be having double triad, facing the eyes and at the same time facing the asthmatic problem. So that's why I say let me tell the doctor, please. Thank you very much.
All right, thank you. You say your name is what again?
Matthew from Ankpa.
Okay,
Yeah, go on.
Matthew from Kogi, right?
Yes.
Yes, Ankpa, Kogi State.
All right, thank you very much, Mr. Matthew. And Doc, this is how we talk about self-medication.
Well, no, not self-medications. Beta blockers. Timolol is the commonest anti-glaucoma eye drop.
Okay.
For patients with asthma, it can make it worse. You know, but there are other options. You know, that's why we take history. That's why we don't go to anybody. See a medical doctor who will take your proper history and ask you other health conditions, what called comorbidities.
Yeah.
Because you're not only managing just the eye, you're managing the whole patient. You know, you wouldn't just say, okay, people say, Azata and Azawute. You will save the life and then start saving the eye. So we have other options. It is correct about what he said, and you can see what he told you about battery acids, you know, causing his problem, both the glaucoma and the cataracts. So I think he should see an ophthalmologist to change.
He said he's not in a location.
No. He has to go to Lokoja, you know, because that's the capital. He has to move to Lokoja and see an ophthalmologist. If he has a room, I would have given him the name of one, Dr. Male, who's trained here, you know, who was the head of their health management board. Okay. He has retired, but also I think he also runs a private clinic there. Okay. He can also go to Lokoja, the Federal Medical Center, Lokoja, the teaching hospital, and he will see an ophthalmologist. You know, he has to make efforts to save his sight. You know, if there's no food in Enugu and there's only food in Nsukka, we'll be going to Nsukka to buy food. You know, so that we can sustain ourselves.
Yeah.
So I'm just trying to make a practical point.
Yeah, true.
That you know, we don't need to. The ophthalmologist need not start coming to Ankpa to see you. You know, because you are the one that needs to see him, and that if he does that, that means the doctor will not see 10% of the patient he should see in a day, because he will go to Ankpa, see one patient, he will leave Ankpa and go to another location and see another patient. No, it doesn't work that way. You know. So what the government has done is to provide you health facilities and personnel. So you should do the needful and come there and see the ophthalmologist, who will change your medications to something that will not aggravate the asthma.
True. All right, let's still take more calls. 0704 550 2840, 0909 771 1009, as well as 0902 311 1009. Feel free to ask this question. Dr. Binashuobi is right here in the studio. Hello, good morning to you. Hello, good morning.
Hello. Good morning, TBK James.
Yes, good morning to you.
And you are guest in the studio.
Good morning, sir.
Okay, my name is Osman, the chemistry teacher, calling from Olo in the Zagoko government area. So I want to ask the doc this question. Doctor, what is the difference between ophthalmologist and the optometrist? Thank you very much.
All right, Doc, you got the question?
Yes, I got the question. The optometrist, you know, is a course that graduates do, undergraduates do for 6 years. and they're also part and parcel of the eye care team. You know, what happens is that in a proper setting, in a teaching hospital setting, when the patient comes, he sees the medical doctor, and that the patient feels, okay, this patient may need to be refracted. The patient has a refractive error, myopia, astigmatism, hypermetropia. You know, he calls on his friend, the optometrist, please refract this patient. Do you understand?
Yeah.
So he does the refraction and sends to the optician to produce the spectacles. You know, so then the ophthalmologist is a medical doctor, full-blown medical doctor, who had done 6 years in the medical school, graduates, you know, and comes to spend another 6 years studying the eye. So he is the physician and surgeon of the eye. You know, and he's almost always the head of the eye team. You know, so in that eye team, you have the doctor, you have the ophthalmologist, you have the optometrist, you have the ophthalmic nurse, you have the optician. You know, you also have the other staff that supports, you know, supporting staff that help the eye team. You know, so the ophthalmologist is the first, and then the optometrist is the second. Both are graduates of any good university.
All right, thank you very much, Doc. I just have a question, okay,
Done.
myself. In your own experience, Doc, okay, what misconceptions do people have about glaucoma?
Okay, thank you so much. These misconceptions are first, you know, people feel that because my parents never had it, I shouldn't have it. Secondly, because my dad and my mom read till the age of 90 before he or she died, then I should also not have it. Then, very importantly, that he sees well, you know, and does not see reason why he should come to hospital. Then the fourth one, for those who say, even if people around them have, the mother or the father have glaucoma, that it is not their portion. And therefore, he's alienated from the human flesh. He does not have the eyes we have. These eyes are not prone to any disease, you know, and so this is a very big deceit, you know. So I think these are real misconceptions. Then, very importantly, for those who now know they have, they not believe that there is no surgery. And most annoyingly are those who do not seek medical help, who start looking for herbal help. You know, that is not only annoying but very injurious. You beginning to be in the hospital and see people who have applied urine, you know, into their eyes, who have applied the pawpaw water, who have applied one salt water or sugar water, you know, in their eyes. So when they now see the consequences, you know, there are things that they say the wise man does. He does not allow it to happen to him. He sees it happen to another person, then he takes precautions. True. So people should know that you don't need, for those who, when they are bathing, they allow the water to enter their eyes. That is wrong. You know, that's why God has given you tears. The tears are fluid that clean the eyes and, you know, and keeps it well lubricated and wet. So these are misconceptions by people, and I think that people should begin to be wise. It is cheaper, always cheaper, seeking medical help than self-medication. Always cheaper, you know. So it's good for people to be well guided. And I keep saying, you know how we say our people go to, your car has a problem, you don't take it to the tailor, you don't take it to you go to the mechanic. True. You know, that's the truth. That's the problem. And your cloth is torn, don't take that torn cloth to the mechanic. It shows something is wrong with you. You know, maybe you need evaluation. You know, so this is the actual truth that people should know, that their eyes have been given to them by God to protect, to ensure that nothing happens to those eyes. And what do? You know, just like one who buys a car and you want that car serviced, you also need to ensure that your body is well serviced so that you could live longer and healthier and happier. Dal.
To live longer, healthier, and happier. Well, ladies and gentlemen, this is how we would wrap things up on Viewpoint, the conversation on Solid 100.9 FM. Finally, Doc, just tell us your advice that you would give to, our listeners on protecting their vision and avoiding these small mistakes.
Ndị be anyị daalụ. Ọ dị mma ka achụ ewu ojii mgbe ihe ka dị. Ọ dị mma asị eme ngwa ngwa emewara ọdachi. Ihe dị mma dị mma. Ọ dịkwanụ mma onye ọbụla nwere ọrụ na-arụ. Ọ dịkwanụ mma mmadụ ilekọta onwe ya anya. Ndị Igbo sị na mgbochi ọrịa ka ọgwụgwọ ya. Prevention is better than cure. Our people, everybody is prone to glaucoma. So annual checkup will not cost you much. It is only essential that you do the needful. And that if you tell the people that you need to have your checkups, they will oblige you. And very importantly, for those who don't take their drugs, who have glaucoma, know ye that blindness is a costly venture than taking drugs. Dalono.
All right, ladies and gentlemen, I'm sure you got the message, and this is how we wrap things up on the program this morning. We'll be back same time, same station next week, Friday. Till then, stay out of trouble, do not drink and drive, and take proper care of your eyes. To have yourself a wonderful weekend. Bye-bye.